Our first presenter is amazing. Dr. Stephen Dobscha is the director of the Center to Improve Veteran Involvement in Care at the VA Healthcare System in Portland, Oregon. He is also a professor of psychiatry at Oregon Health and Science University. We are so lucky to have him share his research and information that he's been discovering over the last few years around OpenNotes and mental health. I'm handing it over to you, Dr. Dobscha. Thank you.
All right, thank you, Liz. I'm going to be speaking about really about the results that came out of a project that we did a few years ago in the VA health system. The project was supported through VA research funding, and I'll just mention that neither Steve nor myself have significant conflicts. So to give a little bit of background, the VA has had an electronic health portal called My Healthy Vet really for probably almost 15 years now. But in 2013, so 8 years ago, authenticated users of My Healthy Vet gained the ability to access all of their progress notes. It's essentially called VA OpenNotes, and interestingly and different from a number of other organizations, there is no provision to block notes, including mental health notes. And we've never really had that. It just kind of all happened in January of 2013. And so it's been an interesting course. And just to give some sense of context, about 2.5 million VA users have now either viewed or downloaded their notes through the blue button that's available in my. I'm not going to spend a lot of time on OpenNotes in general, but just wanted to give a little bit of background. So there was a hallmark study. Tom Delbanco, Jan Walker, and others completed a study published in 2012 of 3 hospitals involving over 100 primary care providers and almost 14,000 patients. And in that study, they followed both providers and patients for up to 19 months and essentially found that almost all of the patients reported that OpenNotes helped them feel more in control of their care. A large number reported increased medication adherence. And among the primary care group, a majority reported that OpenNotes strengthened the relationships with their patients. And this included enhanced trust through transparency, communication, and shared decision-making. And in contrast to worries, the primary care providers reported really more modest effects on practice activities and workflows. Jan Walker did a 7-year follow-up study with those cohorts and found that those positive patient experiences continued. Also found, though, that fewer than half of the clinicians and patients were discussing notes during visits. And this is a theme that's come up a few times in our projects as well. So we don't, in contrast, and I'll just say that there's been a number of other studies on use of OpenNotes, generally showing positive impacts. But we don't know nearly as much about OpenNotes use in the context of mental health. Mental health notes typically contain more details, more sensitive types of information, and that may be a big factor. For example, so there may be documentation of trauma. There may be certain diagnoses that carry stigma and that clinicians are often uncomfortable talking to their patients about, such as personality disorders. People may have concerns about the risk for violent behaviors. There's questions about what do you do when a patient has delusions and may be in the office for a different reason than you think they're in the office. And then there also may be private information about other individuals who are close to the patient. And we have learned that it's not always just the patient who views their notes through OpenNotes. It may be a family member. So, before I move on to our study, I will mention there were a number of early studies done on paper mental health notes. Those studies were done in the late 1970s into the 1990s. Probably the majority were on inpatients and with smaller samples, case studies type of things. But basically finding that patients who had mental health conditions did report better understanding of their problems. Most felt comfortable. Even if they felt uncomfortable, they preferred to be able to see the notes. But there were other downsides. So they did find offensive and stigmatizing language sometimes caused some upset or created more pessimism. I have all these references if anybody ever wants to dig into them. They're pretty interesting. So our study, again, a VA-funded study, really had two main goals. One was to understand veteran and clinician perspectives and experiences with OpenNotes in mental health care. And then we sought to use that information to develop and then evaluate web-based courses. So we created one course for clinicians and one for veterans. And those courses were designed to minimize unintended negative consequences of OpenNotes, but also potentially optimize collaboration and communication through OpenNotes. I can't mention all my colleagues and consultants and people who helped, but just to say I've listed many of them here and want to thank them all. So how do VA patients who receive mental health care feel about OpenNotes? So one part of our study is that we had 28 interviews with veterans, and these veterans had all read at least one of their notes through VA's Blue Button. And several key themes emerged. Well, probably the biggest had to do with trust. Trust was a big issue. It was found to be very critical to the therapeutic relationship in general, and the veterans tied reading their notes to either being able to strengthen or strain trust in clinicians. And probably if a patient has a good relationship with a clinician to begin with, OpenNotes, being able to read notes may not have a huge impact. Similarly, if the patient doesn't have any trust for the clinician whatsoever, I'm not sure that mental health, reading their notes is going to make much of a difference. But there was definitely when you have a newer patient, when that relationship is a little less clear, it seemed like reading notes was important. I'm not going to read all these quotes. I'm going to say just a few. So one of them, a veteran said, "Did the clinician actually listen to me? It seemed like a very different person written about in the notes at times." And a more positive one, "I like the way that my clinician puts them in because he's very blunt and honest. He pretty much says exactly what I've said. And what I really like about it is that he also puts in there what we've talked about and what I said I would do." And that's a theme we did here, is that it's important that notes have at least a little bit of information about what happened in the session today. Many, many notes are boilerplate. There are lots of cut and paste going on. I read a lot of notes during my research, and it's kind of disappointing. It doesn't take that long to put in a couple of things about what happened in today's session. So we also did some longitudinal surveys with veterans. 359 veterans participated in that. I'm not going to go through all these other than to highlight that our sample really reflected Oregon's veteran population, older, white, male. Our group was also probably slightly better educated, and almost 2/3 had PTSD and almost 2/3 had depression. So what did we find? These are some data that came out of the baseline surveys that we did. Next slide. So what we see is a number of positive things that the veterans have reported. Most are reporting that they were very supportive of mental health notes being available online. They felt it was very important to have access to their personal health information through the Blue Button, very likely to be able to understand mental health notes. And actually, most felt that it was likely for the notes to accurately describe what happened in their appointments. So this is a group that had at least a little bit of experience with OpenNotes. Now, the flip side is, and one of the main concerns has to do with causing stress or worry. So we only found that less than 10% found that reading their notes often or always caused stress or worry. The number who reported some upset was larger. Probably 26% reported that sometimes they had been upset or worried about what was in their notes. But very few really reported that this was a pretty important problem. So switching to clinicians now, how do clinicians feel about OpenNotes? So again, we did another set of qualitative interviews with 28 clinicians. And there were also a number of interesting themes, or what we thought were interesting, that emerged. So clinicians expressed concern that by reading notes, patients would negatively misinterpret their notation or feel judged or stigmatized. quote, "There's lots of technical information that's included in notes that could be scary or off-putting or confusing without context or someone to help explain it." Again, this is a quote from one of the clinicians. Clinicians also express strong desires to protect patients from harms that might result from reading note. My interpretation of this is that clinicians in our healthcare systems are still very much caught up in the biomedical model. And in the biomedical model, individual clinicians are held responsible for bad outcomes, as opposed to a more patient-centered type of framework where patients and clinicians may both share accountability if things don't go well. Next slide. Another theme was that some clinicians felt that the notes had potential to undo the work that they'd been putting in to develop a therapeutic relationship, and this came up in the context of people who might be clinicians working with people who had psychotic conditions. Clinicians, on the other hand, this is the positive, felt that despite their discomfort, OpenNotes probably helps keep them accountable, ultimately resulting in improved care documentation. We also had quantitative findings from the clinicians. Now this is also from baseline data. I'm going to start with some of the negatives. So this is really earlier on. This is from about early 2015. So OpenNotes had been already been active in the VA, although not very many patients were using it then. But at that time, almost half of our clinicians felt that they would be somewhat to very pleased if mental health OpenNotes were discontinued. And some 40% were worried that patients would be confused or might disagree or find errors in the notes. And about a third worried about patients worrying. On the other hand, about 41% were very to extremely supportive of providing online notes in general, and about 30% felt that mental health notes should be available to patients online. That's very to extremely supportive. About a quarter reported that they often or always discuss in advance what's contained in notes to be written, and about 11% reported that they'd see more trust from their patients. So I wanted to focus just for a minute on clinician experiences of negative events. And so we asked clinicians if they were aware of any specific negative consequences that had occurred in the prior 3 months. And these are the baseline data. And it was a relatively small percent, about less than 20% reported that they'd seen a negative consequence with one of their patients. Most of the time when that happened, it had to do with being upset or disagreeing with a diagnosis. And another one patient was concerned about effects of compensation or insurance. And in the VA medical records are used to make VA disability determination decisions. And so this is of high priority to our veterans. So that's important to keep in mind about the negative consequences. We did have 2 out of 27 report that there may have been violent ideation expressed in response to reading notes. Unfortunately, I don't have any more information about that, and I don't know of other researchers who have really been able to dive into that. It's extremely hard to gather data from the VA system on an event like that. And I will say that the experiences over time from these clinicians, so we surveyed them multiple times over 12 months, and that proportion that we're reporting some type of a negative experience stayed about the same. So I just wanted to say there are a couple, where it says additional study, we have some work done by Chimowitz and Dr. O'Neill, my colleague today, also done of psychotherapy notes. And basically what this shows is that people have found similar findings. What we see is that patients find notes to be helpful. There's some evidence that they don't talk to their clinicians about them. And there is occasional times when people report some upset. So to summarize what we're finding with veterans, veterans find benefit. A minority note more stress or worry. As I noted from the qualitative work, OpenNotes can either enhance or diminish trust. We did have a sub-study where veterans did say that they often weren't talking to their clinicians about reading the notes unless they were asked. And that seems to be, again, a common theme. Unless you're talking about open notes with your patients and orienting them to the notes, their availability, they may not talk to you about them. And the potential benefits may be lost, or at least some of those benefits. We did find from our qualitative work that veterans who frequently were upset just chose not to read their notes. So that might be somewhat reassuring that if you have a patient you're working with that's getting frequently upset, maybe it's not in their best interest to be reading notes. One other thing, finding I wanted to mention is that we did find that patients with PTSD were more likely to report negative emotional responses to their notes. On the other hand, they were twice as likely to read their notes, and they reported increased patient alliance from reading notes. So this is definitely an area I think worthy of more research, really to kind of explore what's happening within the PTSD group. And just to, again, summarize the findings from clinicians, we do see that clinicians have a wide range of opinions and ambivalence about open notes. I don't think that's changed too much. I think clinicians have gotten more used to it, but in the VA, it's kind of the way it is. That ambivalence continues. And what I see is that people often like the idea. Most clinicians kind of like the idea, but they worry about particular relationships, particular circumstances where they may not want to share notes. I think I've said these other things, so let's keep going. So a couple other things. We did produce training programs. This is an active training program, and right now, I suspect you would be able to access it if you tried. But aside from that, I'm happy to share detailed outlines of our program information, both for clinicians and for veterans. If anybody wants to send me an email or reach out to me, I'm happy to provide that information. So I can't go into the training program, and I want to be sure and turn things over to Steve in a minute, but one of the frameworks that we use to guide how to write notes was the CLEAR strategy, and so I thought I'd walk through that for just a minute. So connect, the C in CLEAR refers to connect, which really has to do with connecting the visit to the notes. And the idea is to provide transparency in the visit and generally try not to have something that shows up in the note that wasn't discussed in the visit. I think if you're worried about potential negative consequences, if you can do just that, not to try to put new stuff in, then I think you can avoid some potential negative problems. Language is important. It's important to be thoughtful about acronyms, not so much acronyms, but I think stigmatizing language, judgmental language. For example, you don't want to call a patient a schizophrenic. You want to talk about an individual with schizophrenia. I mean, there are some subtle things you can do. And if you, I think Steve is going to talk about pretend the patient's looking over your shoulder. And I think or I saw that somewhere, but that's a really good rule of thumb. Just be thoughtful about your language. I think you want to encourage provide encouragement by documenting at least something about patient strengths or progress. Again, it doesn't hurt. It can take a sentence in a note, but I think that can really help. Being mindful of your audience. So one of the biggest concerns I have is how much detail mental health clinicians are often putting into notes. And it's interesting because on one hand, many of our patients say they like the detail, they want the detail. On the other hand, I'm not sure you need to have a lot of detail about the trauma, or you don't need to put it in every note. I mean, you just need to think about what do you really need to do your work, and what do other clinicians really need to do their work if they are providing care or taking over care. So my advice is to err on the side of a little less detail if it's not needed. And then finally, respect. I think highlighting that individuality, again, putting one thing in your note, at least one thing in your note about this is what happened today, what the patient said, that really helps rather than kind of just cut and paste templated notes over and over. Just there, I have a list of references at the end, but this article that I mentioned at the bottom is a synthesis of a lot of information we gathered from both veterans and from clinicians. And I'll mention that we did our work on veterans. Veterans are older people, but they have a lot of similarities to other people in this country. So I do think that a lot of our work is very generalizable. And veterans aren't even that older anymore. I should take that back. The population's getting younger. A couple of words on challenging situations, and then I'll turn things over to Steve, and who may be able to help provide a little bit more information. So if you have a situation where you're really concerned about what goes into the note, one of the things you might want to do, and I know clinicians do this now, is to openly discuss with the patient what you document. And reasons for including, so there aren't surprises. And the other thing that I think clinicians have done is sometimes actually sit down and write the note with the patient. So this can be, I mean, these are obviously not something you're going to do every time, but it is something that you might want to consider for certain circumstances. You might want to consider, and this obviously depends on the situation, asking a patient about his or her preferences for how much detail to include in a note. I don't know if it's so much about preferences, but about kind of having a dialogue about what goes into a note, what you feel you need to write, and sometimes there may be a little leeway there. I think getting advice from colleagues or a supervisor before completing a note, if it's a particularly difficult situation, can be a really good idea. Just another set of eyes. Again, considering which details to include in the note is also important. And you do want to keep in mind family members may access a patient's notes. And I have here a note about keeping psychotherapy notes. And so I'm talking about the formal HIPAA type definition of psychotherapy notes, which are not part of the record. I think it's a little unclear right now what the status of those will be over time. This also might be a situation where one of those few times where you might block access to a note. In general, my experience is that it should be really rare where you feel like you need to block some kind of access to a mental health note. I don't know if Steve has different thoughts about that. And finally, what can really help if you want the patient to potentially benefit from notes? Talk about the notes with the patient. And we did find in our study that orienting to patients to OpenNotes was associated with a 4 times increase in the odds of those patients actually reading their notes. And some health systems like Kaiser, I know, sends out notices after appointments saying, read your notes. I don't know if they're doing that with mental health, but they certainly have been doing that with other notes. All right, that's the end of my talk. Thanks very much.
Thank you so much, Dr. Dobscha. And it's so helpful to hear about what's been going on in the VA, which has just been more historically very transparent within your electronic health record and patient portal for years, long before OpenNotes really became a thing, and clearly before this cures rule and information sharing rule that's going to affect April 5th has been in place, so many folks can learn from what you guys have been doing for so many years.